When someone comes to me asking for a preconception counseling or putting forward their thoughts of getting pregnant, I always suggest them to go for a lean protocol. That is lifestyle, exercise, attitude, and nutrition. In our current generation, having a healthy lifestyle, I think, is very important. Not many of us concentrate on our lifestyle. Not many of us concentrate on getting 30 minutes of active exercise in a day, and not many of us have a very good nutrition nutrition that we are able to give to our body. It's quintessential to actually concentrate on these 4 things. That is the lifestyle, exercise, attitude, and nutrition. When it comes to having a lifestyle, having a healthy lifestyle, make sure there is no excessive consumption of alcohol or smoking. When it's coming to exercise, make sure we're getting that 150 minutes of exercise in a week. And our attitude towards getting pregnant, are we on the same page like that of a partner, or why do we want to get pregnant? Is it because of the peer pressure? Is it because of the family forcing us to get pregnant? Or is it because our friends are pregnant and we feel that it's time for us also to get pregnant? And nutrition. So how many of us think we are actually getting the right amount of nutrition or the right kind of nutrition? I can't think of a single person that I know who is actually counting their nutrition well. The lean protocol is very, very important before you start your planning for getting pregnant.